recent surgery, it's hardly ever going to be in a normal state. Meaning, if a person has had recent surgery, the D dimer level will always be high. So it won't help rule out anything actually. So that's why this is a very, very dangerous answer choice, because A looks good. A is very popular. A is the first answer you see. So as a test writer, they might say, hey, let's try to get a couple of students, couple of doctors. Put A as D dimer. Question stem asks about DVT. Boom, that's your answer. We have to be very, very careful, because this would not be the most helpful way to establish a diagnosis. It will be this one, ultrasound. Okay, and we'll go through it, right? So let's look at D dimer again, because we're a team here. D dimer, frequently used to rule out DVT, but it's used only to be when pre-test probability is low. And again, the well score shouldn't be anything to worry about. You could look into it, but for now, I'd rather you know about the D dimer, ultrasound. I need you to go through these. These are important to know too. Okay, D dimer is not recommended in postoperative patients, because the D dimer is rarely normal in the state, leading to false positive anyway. D dimer is one of those tests where you do a D dimer. If it comes back positive, all right, well, you don't know what's causing the D dimer. You don't know what's causing the thrombosing, right? If it's negative, you're like, all right, well, there's no D dimer. Maybe they don't have a PE. But the D dimer is used in many ways. In this instance, as you see here, a D dimer, fibrin degradation product released when plasmid cleaves cross-linked fibrin. Increased D dimer indicates recent intravascular coagulation and fibrinolysis. For example, from DVTs, pulmonary embolisms, and DICs. So even if you have a positive D dimer, you still have to go further into digging, okay? This is a great question, because it allows us to read the scenario. It allows us to basically understand it's a DVT, and it works on having the patients to make sure that we don't get trapped, okay? And I hope you understand, ladies and gentlemen, this test is meant to trick you. It's not an easy exam in that way. The MDs and PhDs are meant, they're instructed to write questions a little tricky. That's why whoever wrote this question puts this as A, because it's not fair. It's like, well, A looks good, and that's why 18%. And maybe if I was tired, exhausted, maybe if it was block number 6 or block number 7, and I'm just like, man, I want to finish this exam, I might have picked A because it looks good, right? Because that's the whole point. I need you to remember, anytime you choose A, always stop and say, I remember Stavros telling us, A looks good, put it on the side, eliminate all the other answers, and then before you choose the answer and move and proceed forward, double check again the question stem. Just because that's what I do. I'm like, hey, A looks good, but I know that they might play with me, right? So be careful. Okay. Now look at this one. Compression ultrasound is test of choice for diagnosing DVTs. It is affordable, reliable. It's ultrasound, guys. You can do it by the bedside. It's very, very easy. Very first line. Sonography findings that suggest a thrombus includes a non-compressible vein, visible hyperechoic mass, or absent or abnormal venous flow. Ultrasounds are very easy to do. We could do it by the bedside. This will give us all a headache. Do not learn this now. But if you really wanted to, you would say, okay, suspected DVT, we have to calculate. You don't have to calculate on for step 1. It gets really, really complicated here.